Welcome to Eye Contact. I'm Henahan. We're talking with Dr. Soosan Jacob about what you need to know to prepare to perform your first cataract surgery. Welcome, Dr. Jacob.
Thanks, Sean.
Well, you know, Louis Pasteur famously observed that fortune favors the prepared mind. How does this apply to an individual preparing to do that first solo cataract surgery?
Yeah, I think it's really crucial to be prepared when you do that, and if you've prepared well enough, it's half the battle won already. You know, the ways that you can prepare are numerous, especially in today's world. There's so much of stuff very easily available at your on your phone, at your at hands for you so easily that it's actually not a very difficult job. You can attend didactic lectures in your university at meetings like the ESCRS, where you really get to learn a lot of stuff, especially for beginners, the YOS sessions and so on. And then of course you watch surgeries being done by your colleagues, your seniors. It's also nice to watch surgeries which are being done by the juniors as well, because then you kind of see what mistakes they're doing, and you get it into your mind that you should try and avoid those. Learn from their mistakes, exactly. So, so half of the battle is actually preparing yourself. You can of course YouTube videos. That's a beautiful way to learn, because unlike in the real life scenario where you cannot actually review and rewind and watch it over again, in the YouTube recorded videos you can actually rewind and go over that step again and again and again until you kind of think that you've got it right.
Well, you suggested in your column that the beginner needs a combination of caution and confidence. What's the ratio?
Yeah, I think that's a pretty good question, and it might vary from person to person. But I would probably put it as 40% confidence and 60% caution, because that's your first case.
Not too confident.
Yes. I mean, yes, you do need to be confident.
That ratio changes with experience then.
Yes, exactly. You want to be more on the cautious side, because you may make mistakes and you need to be cautious in trying to avoid them, and also if you see them, to recognize them, and then be prepared to hand it over to your mentor, or do whatever is required at that moment.
What about the physical aspects? We were talking about the the mental side, but you're going to be using pedals and operating instruments and looking at videos and so on. How do you prepare for all of the physical aspects?
Yeah, that's again very important. You're going to be working with the phaco machine. So that's something that can appear daunting, and so you need to go prior to the surgery well in advance. Actually, you need to do this as soon as your residency program begins, and go and keep understanding the machine more and more, the fluidics, the dynamics, and more so the pedals and your control, the foot control that you need to exercise over the foot pedal. So learning to identify the foot positions, learning to hear the sounds that come from the phaco machine and understand what each of those sounds means, and also locating the important buttons, the reflux, for example. You've got the posterior capsule, you don't want to be hunting around at that point of time as to where the reflux button is. So all that preparation is really important. You need to know your instruments, your forceps, your excess forceps and all that. So these are some key parts of the surgery which you would want to train well in advance. You have that artificial anterior chamber which you can connect to the phaco machine and do all of this in a simulated situation, of course also on the simulator eyes.
What about the psychological aspects? There's going to be some stress in any procedure, but probably no more than in your first or second procedures. Do you have any tips or tricks for just relaxing and calming down before you begin surgery?
Yeah, I think, if you know that you've prepared for this moment well enough, it gives you that confidence. So be well prepared. That's tip number one. Second thing is calm yourself down. Of course, maybe you could do something that you like just before surgery. You could listen to some music, or you could just chat about the first case with your mentor, about what is specific in that particular case, how he would want you to do, or what are the steps that he would like you to do. And it's important to be also, when you start off, have that whole series of steps that you're going to do rehearsed in your mind, so that you're not wondering what you're going to be doing next. You're kind of going on a mode where you know what is going to happen next. You should also be aware about the complications that can happen, so that you're kind of seeing them happen, and then you recognize them happen, and you don't keep on carrying on without noticing it. So that's important. It's also important to not have knee-jerk reactions, like for example you have a posterior capsular rent and you just pull everything out. So you need to be in command, and you also need to be willing to give the case over to your mentor when required. Ask for help. Not hesitate to ask for help when required. So yeah.
Well, suddenly the OR will be your new domain. How do you prepare yourself to get familiar with the OR itself and get comfortable in that environment?
Yeah, so that's again important. It's of course you already know your mentor, so that's a plane of comfort that's already been established well in advance. Also, your assistant nurse, it's important to kind of be on good terms with her, on a confidence level with her, and she should also be a person who's patient enough, because this is going to be the first case. It's obviously going to be taking more time than someone who's more experienced. And then other small things like, choosing the right height, the trolley of a right height. You don't want to be kind of hunched over on the microscope.
Sure.
You want to be comfortable while you're doing. You don't want to lean over and make yourself uncomfortable. Have the patient's head positioned well towards the edge of the trolley again, so that you're not really leaning over, and also so that you get a good red reflex. The chin should be up. Choose a good case for the first case. A patient who's likely to be patient and not going on asking when is it going to be over and things like that. Also, not the second eye of the patient, because the first eye could have been done by someone who's experienced, and then the patient starts wondering why the second eye is taking so much more time, and you don't want that question coming out just when you're struggling with the, nucleus emulsification or whatever. So these are important things. Important to also know your instruments, your devices. Don't take tough cases. Take something that you know is going to be an easy case for you: widely dilated pupil, not a deep set eye, an eye that can be accessed easily, and give a good anesthetic to the patient. That's really key. Yeah.
You've covered this in detail in your column in EUROTIMES, but one thing you didn't mention is your first cataract procedure. Do you remember it? How did that go?
Yeah, I do remember it. This was many years ago when I started my residency, and this was in India. We have large mass scale camps where patients who cannot afford to undergo cataract surgery and who are close to blind, having very mature cataract, they were being brought back to the university training center in camps, in vans, and they were operated at the base hospital, and then they were sent out. So at that point of time when I had joined, it was actually the last maybe few months where intracapsular cataract extraction was still being practiced for these patients, for these camp patients. And I remember, hooking the superior rectus and taking the brittle suture. I had a senior, of course, surgeon assist me. And then we had this Van Graaffe knife, which, you slice in from one side of the cornea, go across the anterior chamber, come out of the other side, and everything is in one quick motion. So you're going across and then slicing out, and then it's over, and the antechamber is just like that, it's not collapsed either. Then you go ahead and take it out with a cryoprobe. So that was my first cataract surgery.
Amazing how times have changed.
Yes, absolutely.
Well, thank you so much for joining us.
Thank you. It was a pleasure, Sean.
For more information on this, you can read Soosan's column in EUROTIMES at eurotimes.org.